Today's program includes a structured discussion with our distinguished panel and then an open Q&A segment. You may use the chat function at any time to share your questions and or perspectives, which will be saved for the Q&A segment. You may also unmute during the Q&A to ask your questions aloud. It is now my pleasure to introduce our panelists for today's Health Psychology Internship panel. Our presenters include Sara Hoffman Marchese, PhD, currently a postdoc at Rush University Medical Center. Avelina Padin, PhD, currently a postdoc at the Center for Women's Behavioral and Mental Health within Rush University Medical Center. And Terence Penn, MA, currently on internship at Harvard Medical School, Massachusetts General Hospital, who actually also just defended his dissertation. So maybe that should be a PhD there. If we were in person right now, I would ask everyone to give a round of applause, but maybe you can silently clap on camera or use the function to show your support and excitement. And with that, I'll turn it over to our panelists. Why don't we first start with a brief overview of the journey you've taken up to this point? What was your doctoral institution and what steps have you taken since then? We can start with Sara.
Sure. Hi, everyone. So I did my PhD program in clinical psychology with an emphasis in behavioral medicine / health psychology at Northwestern University Feinberg School of Medicine in Chicago. Just overall throughout my graduate training, I did many different health psych rotations that I'm happy to talk about if folks have questions. Was also heavily involved in research. In my last 2 years of my program, I had an F-31 NRSA grant that funded my dissertation work. So happy to answer questions about that as it pertains to internship. And then did my internship at Rush University Medical Center on the health track. And I am staying on, as Madeline said, as a postdoc in bariatric and health psychology, and also doing a little bit of oncology work on the side. So that's kind of an overview.
All right, next we'll have Avelina. Is that how you say your name?
It's Avelina.
Yeah,
so great. So I'm coming from Ohio State University. Originally, I was in their clinical psychology track, and similarly to Sara, did an emphasis in health psychology while I was there. I also did my internship at Rush University Medical Center in their health track. And through both my doctoral training as well as internship, I did a lot of broad health psychology training, inpatient and outpatient, with lots of different health populations. So for postdoc, I chose to narrow in a little bit. I am still at Rush as well, but my postdoc is focused on women's behavioral health. And my postdoc is about a 60% clinical, 40% research split. And I'm definitely happy to talk a little bit about, for folks who are wondering about how to split research and clinical work going forward, happy to talk a little bit about my experience. Thanks.
And last but not least, Terence.
Hi, everyone. My name is Terence Penn, and I'm currently a 6th year PhD clinical psychology student at the University of Alabama at Birmingham, also called UAB. During graduate school, I specialized in adult health psychology or behavioral medicine in both my clinical and research training. My clinical work, I also did a broad variety of different types of experiences, from doing like neuropsych assessments for people with mild cognitive impairments to helping treat people with functional neurological disorders. And a lot of my work also involved helping people suffering from acute pain and chronic pain. My graduate research mostly examined people, or rather like racial and ethnic health disparities in chronic low back pain. Last month, I began my internship in a Harvard Medical School, Massachusetts General Hospital, in the integrated brain health track. And the track has a strong emphasis on clinical science within a health psychology framework. So I'm involved in a lot of studies as a study clinician in that team. And right now I'm already having conversations about planning for postdoc year or other forms of employment. I'm hoping to look at other two speakers for some guidance on that, perhaps. But it's nice to meet everyone.
Thank you so much. Of course, it's necessary to kind of address the impacts that COVID has had on the internship process and application, especially the decision to hold in-person versus virtual interviews. Terence, I believe you're the primary person here who applied to internship during COVID. Can you describe that experience and highlight any pros or cons you have about that?
Sure. Yeah, and Madeline, as you also may know or remember, nearly all internship interviews were conducted virtually last cycle, with the exception of some specialized sites like federal correction facilities. Personally, I found the virtual interviews to be extremely convenient and allowed a lot more flexibility compared to in-person interviews. The internships that I interviewed had already figured out a system to conduct virtual interviews in a straightforward way, I felt. And for the most part, they included all the aspects that you would get from an in-person interview, like speaking with current interns and talking to the director of training. Also, in lieu of being able to tour the city, a lot of internship programs also had like slideshows or like a video showing you like parts of like the hospital you'd be working at or like parts of the city. In my graduate program, past students would often say that coordinating travel plans, like booking flights and hotels, and the sheer cost of travel were the two most stressful aspects of the internship process or application process. And I've heard that travel costs can easily cost upwards $3,000 and above if you obtain like 8 or 10 interviews. And virtual interviews remove that burden of coordinating travel plans and help me save literally thousands of dollars. In terms of cons, I guess virtual interviews requires having reliable computer with microphone and a web camera and reliable internet and a quiet environment. And I acknowledge that not everyone is able to access these things. And I do encourage, like in the case of, we do have primarily virtual interviews this coming cycle, I encourage everyone to speak with your director or any mentors in your program so that they can help provide these resources to you. I do think it is important to be able to visit a location physically. If you're thinking about working there for like a whole year, like on internship, I know, like I mentioned earlier, internship programs do their best to present their facilities and present the city like through PowerPoints or video, but it doesn't replace coming in person to feel it out for yourself, unfortunately. Virtual interviews can be tiring, like as everyone knows, like Zoom fatigue, staring at a screen all day. In my internship interviews, we would get breaks to help alleviate this, though. And inherently, a virtual format does take away some important communication on human aspects of meeting people. So like, for example, you're staring at a camera while talking to someone to give the illusion that you're looking in their eyes, but you're not able to actually look in their eyes. It's harder to read body language, just seeing their torso and their head and so forth. So those were some of the things that I felt about the virtual interviews.
Yes, thank you. Thinking back to kind of early stages, how did you all curate your lists? Did you stick to the 11 to 15 site rule? How did that go?
Go ahead, Sara.
Avelina, unmute. Okay. So I started pretty broadly. And one of the things I think that was most helpful for me was talking to students that were a couple years ahead of me, who had similar research or clinical interests, and asking them if they would be willing to share their list of sites. That gave me at least a starting place of where folks from my program had been successful in obtaining interviews, where folks had matched previously. And then from there, I sort of filled in the gaps with where I wanted to be, maybe geographically. I personally was geographically limited a bit in my search. So I'm happy to talk about that too as we go. But I started with lists from other people. And then for me, I think I sort of took two filters looking at programs that had a health psych track, specifically where I would be doing health psych rotations. And then I also looked at generalist programs that had health psych rotations, but I was also going to be carrying sort of a general outpatient caseload. And those were sort of the filters that I looked at within friends lists of mine, and then went from there. I'll let Avelina also fill in.
Yeah, I feel like I did something really similar. I think asking other folks in your program who liked where they went on internship is a good place to start. And then I definitely knew I wanted to do a health psych internship. So there was some poking around the APIC website to kind of just try and find other places that had what I wanted. So I probably started doing that broad filter search with maybe somewhere between 20 and 30 sites. And then from there, I had really specific experiences that I wanted to get on internship. So I knew I was interested in women's health. And I also wanted to get good sleep training. So I just kind of went through and started knocking off sites that didn't have those specific things. And in terms of sticking in the 11 to 15 role, I think I did. I think I applied to 10 or 11 sites. I'll be honest, I initially had 15 sites that I was preparing applications for, and then I just sort of got burnt out in the application process. And so right around the time to submit deadlines, I think I kicked off like 3 or 4 more programs because I just decided it wasn't worth it to apply.
And I forgot to mention, sorry, I ultimately applied to 13 programs, but similar to Avelina, I think I had 3 or 4 that maybe dropped off last minute.
And yeah, from my understanding, I was recommended 11 to 15 rule because there's been some research conducted showing that that's kind of the optimal number to apply for to optimize your chances of getting accepted, matched somewhere, to my understanding. But I didn't force it. Like, I think I had like 11 or 12 that I felt really good with, and I felt like adding more didn't really make sense. I'm just adding it for the sake of adding it. It wasn't really a site that I see myself going to. Yeah, I mean, and as the other speakers had mentioned, I started broadly, like asking people in your lab or maybe alumni who have similar research interests, asking for their lists and their notes was really helpful for me to avoid some potential sites that wouldn't be a good fit, or like giving, maybe a potential red flag. And I also started pretty early with my search. I guess I started like a year early. I know like a lot of people would say that you don't need to start looking until like the summer before you apply, but if you're someone like me who likes to plan in advance, I found it really helpful to just take my time combing through the APIC directory website, just searching through and like anything that catches your attention. Also, make sure you subscribe to the APIC Match News email listserv. Throughout the application season, they often send emails of new internship positions that open up at the last minute. So I found that as a big resource as well.
Yeah, thank you. Which of the essays was the most challenging to write, and what approach did you use to tackle that?
So I honestly found the personal statement to be the hardest thing to write. And I think that's because that really is it's not your only opportunity, but it's your primary opportunity to allow your personality to shine through a little bit in the application. And so the advice that was given to me that I found really helpful, and it might be too late, it's okay if it is, but the advice that I got that was helpful was see if you can write a draft of your personal statement before you read anybody else's personal statement. Because once you start reading other people's personal statements, you will find yourself wanting to pull things from what they've written. And that is going to detract from being able to allow your own kind of personality and ideas to shine through. So that was the primary piece of evidence I was given. And I think as long as you're sort of staying kind of true to who you are, I think that people, when they're reviewing applications, love to read personal statements that have some personality shining through. So I guess don't feel too afraid to let yourself do that.
I also agree that the approach I took with all of my essays, I guess aside from more objective one like the research essay, I felt it important for me to try my best to draft out the essays without looking at any other examples first. That's not to say if you feel really stuck and need a bit of guidance, like don't feel bad if or don't hesitate to ask for some examples from past graduates. But you know, I also felt that in order to kind of stand out with my own personality, I wanted to come across as, you know, a little some originality. The essays that I found the most challenging were the ones that were not, you know, less objective oriented. The diversity, personal statement, and theoretical orientation, compared to graduate school, where I was always doing academic papers and, you know, making citations of statements from other people. You know, you're having to shift to more personal essay style. So, you know, giving yourself a lot of time to write these essays and try to brainstorm, take your time. I started as early as July, but you don't necessarily have to start that early. Most people start maybe, I think, September. But yeah, really take your time to brainstorm your thoughts, reflect on your experiences and values, and you know, jot those down without trying to write it out as a draft first. And then from there, you can start trying to draft and take your time. Oh, and also ask for feedback. I didn't want to ask for feedback from too many people because I wanted to keep that originality, but choose like maybe like a couple people that you really trust to look over your paper, maybe a mentor or maybe a close friend who's not necessarily in psychology.
I'll just briefly echo what Terence and Avelina said. Personal statement, by far the hardest. Received very similar advice. The other advice that I received for the personal statement was to ask myself, and these are big questions, so take this with a grain of salt. Who are you in terms of a psychologist right now? Who do you want to be in terms of your personal and professional identity, and try to infuse as much of that into the personal statement as you can. And then I ended up having my DCT, my clinical mentor at the time, and my dad read my personal statement, and that was it. And I think that was a good mix, as Terence was saying, folks who knew me professionally, folks who knew me personally, and that allowed for just a couple refinements without having to get too much in my head about, is this good enough? Is this what folks are looking for?
Thank you. So we know it's best to tailor our cover letters for each site that we're applying to so that you can highlight your fit. How did you go about doing this for each of your cover letters?
So I started by writing out the pieces of the cover letter that I knew were going to be the same for each site. So the overall goals that I wanted to have that I knew were going to be similar. Obviously, you're going to have different goals for sites that you can infuse, but what I wanted to get out of internship more broadly, and then my past experience, because obviously that's not going to be any different for which site. In terms of tailoring, then what I did was I looked at each program's brochure, obviously the rotations that I would have the potential to be a part of. Alluding to what Avelina said earlier, I knew that I wanted to have oncology experience in my internship. So most, if not all of my sites that I applied to had an oncology rotation. So part of each of my cover letters was explaining why I wanted to have oncology experience and what pieces of each internship's oncology rotations appealed to me. So there was some tailoring there. And then many of the programs that I applied to also had, even though it's a clinical year, they also had structured or dedicated research time. So I also tailored that piece of the cover letter depending on the research projects that I knew were going on at that institution and or the mentors that I could potentially be matched with on the research side. So I would say tailoring by rotations of interest, research if that's something that you're looking for, but then keeping, I'd say, pretty much everything else for each cover letter was roughly similar, aside from changing names and things like that, obviously.
Yeah, I echo exactly what Sara just said. Triple, quadruple check that you've changed the names on all of your letters to be the correct site. It is remarkably easy to, if you think you did it, just check one more time. But I actually totally recommend having some kind of a template that you're using that's similar for every single site. Do not make so much work for yourself that you have to write a completely new draft of a letter every time. And then I tried to focus on describing, like Sara said, looking at the rotations that are offered and the research opportunities that are offered, describe a couple of ways that I'm bringing strengths already into the program. So, you know, I already know how to do this kind of thing or that kind of thing. I have background experience here. And then really trying to focus in on here's where your internship site fills training gaps for me. And so for each site, I kind of identified a couple of strengths and a couple of growth areas where the site was a good fit for my training needs.
Excellent. So thinking through other components of the application process, so recruiting letter of rec writers, summarizing your hours, what other tips and tricks can you provide?
I personally feel that it's important to start early, and I mean, even if I don't know how many people are here who still have maybe another year out to apply or 2 years, but starting to develop good relationships with your research and clinical advisors is important because like you're going to be relying on them to write your letters of recommendation. So I guess ways to kind of develop that is, you know, typically like letting them know of what your goals are and like keeping them updated on how you're feeling about how things are progressing with the tasks that you're working under them, for example. And I do feel that it's important to also start your internship as early as possible, like at least a year out. It would give you some time to change course if you see you need to get a little bit more clinical hours than you thought you would, if there's like a top site that you want to apply for. And also starting your essays and application materials early if possible, because it'll allow you just to take your time to make good quality work. Also, you know, you will be less susceptible to unexpected things that might happen to you during the fall. Like if you need to really sit down and really work on your dissertation, for example. Let's see. Virtual interviews, if in the case that that's going to be prominent again this coming cycle. If possible, don't connect to the internet over Wi-Fi if you can help it. Use a wired Ethernet connection because that's much more reliable, less susceptible to breaking any type of connection. And also don't be afraid to ask for help. Prior students, alumni, your mentors and advisors, graduate program director, all there to help you if you're feeling lost or anxious about the process. Those are my thoughts.
I would say the best thing that I did, echoing everything that Terence said, the best thing I did in terms of starting early was, if you're willing or have the means to use a tracking system for your hours. I personally used Time to Track. There is a fee associated with it. I can't remember what it is per year. It's something like $30 a year. I found that to be well worth it, especially because that particular program, I'm sure there are others that do the same thing, exports your hours in APIC format so that it is much, much easier when you actually are doing your APIC profile and inputting your hours. It saves you tons of time in comparison to friends of mine that did it from their own Excel spreadsheets or what have you. So that to me was worth the cost and the time savings if you are able to keep up with that as you go. I also recommend, related to tracking hours, setting aside time in your calendar each week to track your hours. I'm sure you all have run across this before. I think I got like even a month behind at one point, and that was not fun as I was trying to do internship applications and also track my hours for that past month. With the APIC portal, I would say start early, as Terence said, filling out any aspects of that portal that are going to be common across sites. You'd be surprised even, inputting your name and address and phone number, things like that, that if you leave those till the last minute when deadlines occur, it's just going to be more of a headache for you. So the more that you can get done and sort of save and return later is the best case scenario. In terms of letter writers, if you had a particularly unique rotation within health psych, like for example, I did a GI psychology rotation, which is a newer, subfield of health psychology. Not as many folks perhaps have had exposure to that. And I had a good relationship with my clinical mentor. So I thought it was important to have her as one of my letter writers to sort of highlight the unique skills that I acquired on that rotation. And then also supplementing that, of course, with my research mentor. My most recent clinical mentor, I think, is an important strategy. And then any subfields that you are planning to pursue as your area of expertise, perhaps, those are all good letter writers to have in that combination.
I'll just say one more thing about tracking hours, because I know it can be a really stressful part of the application. And maybe I can also address this question that's in the chat, which is it necessary to track demographics of clients in time to track? If you're in a stage where you're still tracking hours, then yes, you should track everything. APIC is going to ask you about everything. So if you're still in that stage where you're able to collect that information, it will save you tons of time if you can do it now. If you are at the stage where you're ready to apply and you have not tracked that information, then the advice that I'm going to give is do not obsess over your hours. You want to be as accurate as you possibly can be, while also recognizing that no one is going to go in and double check. So if you have an estimate of like, okay, I really could not tell you how many clients I saw in this demographic category, and there's no way for me to go back and check. I mean, that doesn't mean that you can't apply to internship. It means you might want to estimate like, okay, about 20% of my caseload might have fit this demographic. And so I'm just going to have to give this number as my best estimate. And that is fine to do. So it will take you some time. Set aside a chunk of time to calculate and tabulate all your hours, but don't make yourself crazy trying to track down, in your medical chart record, like exactly who you saw it, it's okay. Just give the best estimate that you can, be as accurate as you can be, and don't misrepresent yourself, and it'll be okay.
Thank you. So I know Terence touched on this a bit, but let's talk about the interview season. Very busy, very stressful time. What are some ways to manage that stress and ensure also that you're prepared and feel like you're going to make a good impression?
Definitely practice answering common interview questions aloud, which you can, I think you can find online if you just search for common clinical psychology internship questions, or even better, like ask your program director if they might have some common questions that they might ask if they're a site as well. And then also, I think it's important to do a couple of mock interviews with clinical psychologists. At least one of them should be someone that you don't really know too well, and it could be someone referred by your clinical director or your research advisor, but you want to try to replicate how the actual interview is like, so that you'll be more conditioned for it, and like for the actual thing you'll be less anxious for that. Personally, I didn't want to do the mock interviews, but I did find that it was helpful for me to be in a safe, like have a safe place where I can mess up and then get good feedback, so that I can correct myself for the actual interviews. Yeah, as I mentioned earlier, with the other question, I meant to say with this section, make sure that you have stable internet connected to a wired Ethernet rather than Wi-Fi if possible. Plan ahead in terms of like, if you have any pets or, you know, like a dog or for example, like plan ahead on how you'll be able to manage that. Like maybe you might have a family member or who might be able to keep the dog for the day. Try to minimize like any potential distractions or loud noises. And also on interview day, I kept a list of summary notes handy for a specific site, because trying to do like 8, 10, 15 interviews, they can start to blur together. And it'd make me feel much more at ease just to have like a little cheat sheet that I can review the morning of the interview, so that I don't have to try to memorize every single thing about that site. What type of information to include? I included like, you know, stuff that I mentioned in the cover letter, types of rotations that stood out to me that I want to do on the internship, types of experiences, like if they have like some kind of special like diversity type of program or like research opportunities. Also made note of like track supervisors, specialized tracks on like what their interests in, I guess. So those some things on the top of my head I included.
I will echo everything Terence said and also add, I had a list of general questions I wanted to ask. I had a general list of questions that would apply to all sites. And then, you know, maybe like on the plane to the next interview or the night before, if you're doing a virtual interview, I made a list of like maybe 5 questions for that specific site, because you will be asked, what questions do you have? And there were times where the interview that I had that was allotted 30 minutes, the interviewer just said, what questions do you have? And we started there. So better to have a list that you can easily refer to rather than be caught off guard. One other thing just in general that helped me, because I am an anxious individual, was reminding myself before each interview that they would not have invited me to an interview if they did not think I would be successful at that particular site, right? And so I think reminding yourself of that, as you know, basic as that sounds, can help to alleviate a lot of the anxiety associated with interviews, especially when you're doing them oftentimes back to back. It gave me a sense of calm to know, like, great, I've gotten to this point. If I were to match here, they know I would be successful. They're just trying to get a sense of what I can, or what I need to be successful there. And I think that's the other thing to keep in mind, is that you are interviewing these places as much as they are interviewing you, right? You know, it's similar when you're applying for grad school, right? But it's more so about your fit with them. Whereas this is more of a bi-directional relationship. So I think reminding yourself of that you have some autonomy in this situation too, helped me to alleviate some of that stress. And the last thing that I will say about interviews, I might have just lost my train of thought and I will come back to it if that's the case, is one other thing. Avelina, you go ahead, and if it comes to me, I'll jump in after you.
Sounds good. Yeah, this is all great advice that you guys are giving to piggyback off of what Sara just said. I actually had fun on internship interviews. I don't know if that's a crazy thing to say, but I found it really interesting to see what other programs were offering and meet people from different places. And I tried to remind myself to just be as authentically who I am as I possibly can. This is somewhere where you're going to have to work for an entire year. And so if you present yourself as different than you are, then you're going to match somewhere that is not the best fit for you. And so being as true to yourself as you can be, this is the first opportunity in a while where you get to say exactly what you're looking for, exactly what your career trajectory is going to look like. You don't need to necessarily please anybody in those answers. And that's going to help you find the place that is the best fit for you. So I would kind of encourage you as much as possible to have a little bit of fun in these interviews and be authentic and just kind of get to know the program as best you can. The last piece of advice I will give is to take notes immediately after your interview. You're going to forget everything that they told you. And like Terence said, they all blend together. So I had like a little spreadsheet where I had a couple of different things I wanted to take note of after each one. So like, what are the research opportunities? Do people actually get time to do research? If that's important to you. It was also really important to me to go on internship somewhere where there was a postdoc in case I wanted to stay. So I always asked about postdoc opportunities and jotted notes down about that too. So if there are things that are important to you at each site, just make sure that you're writing some of those thoughts down after the fact, because you will forget them.
Excellent, thank you. So we'll do one more question for everybody and then open the floor up for the Q&A. So looking back, did the process go as planned? Did you end up going an internship where you always thought you'd go? And if not, what surprises kind of popped up along the way?
Yes and no. I think because of the amount of work I did up front to really research sites, and as Avelina said, have a little fun with the process, be my authentic self, I think I matched where was the best fit for me. I did match at my top site, which was great. And it ended up being exactly what I thought it would be. So I think the more work that you can do up front and the more honest you can be with yourself about what you're looking for, both in terms of the opportunities within that particular site, but also the location of that particular site, because for me, that was incredibly important. I ended up where I thought. In the no was that I also found that I really liked all the places that I went, which did make ranking a little bit difficult. But I think that's a good problem to have, right? So I enjoyed the process more than I thought I would, but ended up ultimately where I thought was going to be the best fit for me.
To go off what Sarah's saying, yes, if you do like you due diligence and research the type of sites you want according to that aligns with your interests and values, you're going to find that you're going to like a majority of, or if not all of the sites that you're going to interview at. In terms of the ranking, I do think that's a kind of a personal process. Don't feel like you need to feel obligated to rank a site high because it's perceived by other people as prestigious. If it's important for you to go to an internship where you'll be closer to family or like other location issues, like if you want to, like spouse has a job somewhere, follow that. You said it, like figure out what your personal priorities are in terms of what you want from an internship site, because also what Sara said, these can often lead to, stepping stone to your next career path, like looking into when interviewing for sites, like, is there any postdoc or other employment opportunities at the facility or in the geographic area, and so forth. It doesn't necessarily have to be that way though. Like internship can certainly just be that year and then you're just going to move back somewhere else. But for me, like I was trying to be efficient as possible because moving can be really expensive. I guess also answered a specific question about the process of it when it was planned. I think it did, and I did rank to my top choice and very grateful for it. I guess right now I've only just started internship, but there are some aspects that from the virtual interview that I wish I was a little bit more informed of. Like location is really big. I didn't get to visit the Boston area during the virtual interviews, but I'm finding that I'm having a little bit of a hard time adjusting to the area and that it's a little bit different than what I thought it would be. So that was one, I guess that's the biggest thing that's not really going as planned. But yeah, I mean, I think for the most part, You can't predict everything, but with what's within your control, like being able to look up sites, doing your due diligence, asking questions. If you have other questions that's not answered on the internship website or brochure, don't hesitate to reach out to the clinical directors. And their email is usually on the internship website or like on the PDF brochure that's on the website as well.
Yeah, so I'll just quickly share my experience with this question, which is that I did not match at my top site that I applied to. However, because of the things that Sara and Terence mentioned, I had done a lot of research to make sure that most of the places that I interviewed at would be places that I wanted to be. And so I was pretty confident when I did my rankings, or at least I tried to remind myself to be confident, that anywhere in my top 4 or 5 would have been excellent places for me to have landed. And so when I did end up landing in one of those slots, as opposed to my number 1, it made it easier to kind of remember, like, okay, so you didn't get your number 1 place, but these are all fantastic places. And I ended up being so happy here that I've stayed for postdoc. So I think reminding yourself that, like, even if it's not the number 1, like you're going to get a great training experience if you've done your homework and you've selected sites where, you know that they have what you're looking for. I also didn't rank a site. So feel comfortable doing that too. There was one place I went where I went like, I wouldn't be happy here. This wouldn't be a good experience for me. And I chose not to rank it. And so if you make choices like that, then you'll know you're going somewhere where you'll be successful.
Excellent, thank you. So we're now going to open it up for open Q&A. Feel free to unmute and ask questions. A reminder that we are recording, or feel free to put it in the chat. So we have one question in here. Can you talk more about applying with geographical restrictions? For example, if you were applying to a specific site because of a location where partner lives, works, family, did you disclose that reasoning in the interview or in your cover letter?
Oh, you go ahead, Avelina.
Oh, sure. Yeah, I'll just go really quickly. I think that this can go either way. So I did apply to a couple of sites. I wasn't totally geographically restricted, but there were a couple places where I would have preferred to be. And when that was the case, I kind of did lay it on a little thick in the cover letter. Like, this is, that there are personal reasons why this is a top choice location wise for me. And I think that's okay to do. I mean, you want to make it clear that the training is also a good fit. And so that's what you want to highlight. But I definitely had a couple sentences in there about why personally for me, the location was a great fit, because I do think that sites want to see in your cover letter that you are committed and interested in living and being where they're at. So I don't think there's anything wrong with indicating that in your materials or during the interview.
Yeah, I didn't have that specific situation about applying for a specific site because of where family works or whatnot, but I do think you can turn something like that into a positive, because as Avelina was saying, there are a lot of sites actually want to see potential applicants to be committed. They'll have a lot of times, like they often hire interns into a postdoc or into an employment position at that facility. So I don't think there's any danger or anything wrong with mentioning that. Like I would mention, maybe I've mentioned something like that at the end of my cover letter, for example, saying that it's a place that I'm excited about, especially that I see myself living there for a longer term or something like that. So yeah, I mean, yeah, I don't think shouldn't be any issues with mentioning something like that.
The only other thing I'll add to that is, so I was I interviewed nationwide, but I was pretty geographically restricted in terms of where I thought I would ultimately end up. And I would just say, again, be true to yourself in your rankings. I ended up ranking many of the Chicago sites higher because that's my partner lives here. He has a job here. We knew we were going to be here long-term, ideally. And I also only applied to places that were in major cities that had airports that flew directly to Chicago. So I was like pretty picky about it. But yeah, echoing everybody, what other folks have said in terms of like, when it was a Chicago location, I did lay it on pretty thick, and you know, it worked out okay. So I don't think there's anything wrong with it.
Thank you. Are there any individuals that would like to ask a question verbally? Otherwise, feel free to keep adding it to the chat. Any verbal questions? Okay, so another one from the chat. A lot of the sites on my list don't have an hours requirement, maybe to add flexibility because of COVID. With no hours requirement, I'm finding it difficult to know if I'm competitive enough for many of the programs. In your experience, how much did total hours play a role?
So for the advice that I was sort of given is that once you're over a particular threshold, that you're okay. And that the difference between, you know, having X hundred number of hours and Y hundred number of hours doesn't really matter as long as you're sort of above what might be thought of as kind of a threshold. And I would ask your DCT kind of in their experience what that number is. But the other thing I will say just about this whole like hours cap is that I did apply to one site where I did not meet the number of assessment hours that they were requesting, and I still got an interview. So even if you're shy a few hours of somebody's like cap, and it's somewhere that you really, really are interested in applying, I would not be afraid to just shoot them the application anyway and see what happens. I know a number of people who had that experience. So yeah, I would say as long as you're over whatever kind of threshold your DCT might give, that there's not a big difference. You know, 50 hours here or there is just not going to make a big difference.
I found that it was similar to grad school in that, you know, as Avelina said, there's a threshold, right? And your DCT will let you know whether they feel like you're at that threshold. But beyond that, it was more about fit. And I was similar to Avelina. I was short, maybe like in a couple integrated reports, and that did not present any problems.
Excellent. So did any of you ever receive any questions that felt inappropriate from an interviewer? And if so, how did you handle that?
Yes. So and again, you know, I think folks' definition of what inappropriate is kind of varies, but this felt inappropriate to me. So like I'm married, I wear a wedding ring, you know, folks can sort of ascertain that I am in a partnership. I was asked at least once if my partner would be moving with me, / if they would be looking for jobs in that city. And it was a city not in Chicago. And so I felt a little bit awkward answering that question. And so I sort of sidestepped it and just said, you know, like we've discussed like all these different locations, and, you know, any location that I would be interviewing at is a place that I could see myself living. And I just sort of shut it down that way, and it was fine. So it was inappropriate in that way, but I felt like once I shut it down, in a, of course, obviously polite and respectful way, it was a non-issue. So I don't know if that's helpful, but that was my experience.
Yeah, I don't think I got anything overtly inappropriate, although Sarah, I would agree with you that that's a pretty inappropriate question to ask. But the one that I got that was sort of hard to answer, and I was not sure what this person was really wanting me to, it felt like there was a correct answer that they wanted me to give, and I was not sure what they wanted, was they asked me at what point would it feel like the number of hours I was being asked to work was too much. So this person was basically asking me to give like a, where do you draw the line in terms of how many hours is too many hours? And it was a really hard question to answer because it felt like they were sort of asking me to give a number that was like as high as I could give without being, you know, way too high. So that was my only experience of of a weird question. I will say, you know, somebody somewhere during the interview process is going to ask you a question that you did not expect to be asked. And it is okay if you sort of have a moment of like, I don't know what the answer to that should or could be.
And also with Elena's question, if I'm having trouble like trying to think of like how I would sidestep an appropriate question, but if it was something that made you feel extremely uncomfortable, I do encourage you and everyone to report that to the internships director of clinical training. I know in a lot of my internship interviews, like that would be mentioned, like the DCT would be saying like, please tell us if, you know, something like that happens. So, and I don't think there's any shame in doing that either. Like there is encouraged that you know, help keep like a safe environment for everyone else too. So that's how I would say it. And I guess if you're really at a loss to how to, like if you're encountered a question, like you can just say that, you know, that's a really interesting question, though I'm not really, I'm not sure if, you know, I'm not, you can just say outright that I'm not comfortable answering it. I think just being straight to the point with it is, I think that's the best action.
And Terence, I guess one other thing that I'll say about that, you bring up a good point, you know, in terms of reporting. I would also say, you know, to let your home DCT know if that's something you feel comfortable doing, only because, you know, there's going to be other students behind you that also apply for these similar sites. And it's something that's good for them to know too, so that they can, if need be, like let other students know that this is something that has come up in the past. So just that folks on both sides are aware if it's something that is a repeated offense, so to speak.
Thank you all. Because of time, we want to make sure we give time for transition. So on behalf of the Student Advisory Council and all of the Society for Health Psychology, please join me in giving a huge thank you to our panelists today for taking the time to share their experience and wisdom with us. And thank you to all the members of the audience for your attention and engagement. Just a quick reminder to renew your Society for Health Psychology membership for 2022, or join now if you have not already done so. If you join now, that'll enable you to participate in teleconferences, webinars, listservs, awards, and other benefits and services all year and also for the remainder of 2021 at no extra cost. And it is not necessary to be an APA member to join Society for Health Psychology. So as stated earlier, the recording of this program will be posted to the Society's website and the YouTube channel. And if you have any follow-up questions or comments, feel free to email us at studentchairdivision38@gmail.com. I'll put that in the chat. And we look forward to seeing everyone at future Society events. Thank you, everyone. Take care.